Hi, good afternoon. So welcome to Reading Live. This is me Vandana joining you from 𝐻𝐄 Academy. Okay, so another day. So we have another new topic here. So what about your day? So please let me know in the comments. Okay, so in today's class we will be discussing about the same thing, which is part B as well as part A. First of all, I will show you a question, sample question from part B. Then we will discuss the answer. Then we will move to part A. Okay, so I'll give you 2 minutes for the preparation of the first question. Then we will discuss the answers. Okay, so this is the question. Okay, so have you all done the question? Okay, how is the question? So I'll read the question first, then the options and the paragraph. So now we will discuss about the answers. Okay, so what is the question? The guideline required those undertaking the preparation of plaster bandages too. So this is an incomplete question because there is no question mark at the end of the question. Okay, and very clearly they've mentioned in which category the question falls under, so which means this is a guideline. Okay, so guideline. If it is a guideline, then what are you reading for in a guideline? So we are reading for the details. Okay, so did you got the answer for this question, the sample question? What is your answer? Let me know. Okay, yes. Okay, Yogeshwari, Reba, Mercy, Marin, yes, good afternoon. Okay, so what is your answer? Let me know in the comments for this question. Okay, so as you know, part B is all about a lot of documents. Okay, we will be discussing a lot of documents in the 6 questions, like guidelines will be there, emails, memo, notices, policy, manuals. Okay. Yes, so this is a guideline. So what is a guideline? As you know, guideline which contains all the information or a detailed information regarding a set of principles, okay, restrictions or regulations and rules. So we are reading for the details in a guideline. And I can say which sentence is important in a guideline. It is always the first sentence. Okay. So don't ever think that first sentence will be the answer always all the time. But I can say the first sentence will give you a lot of clue towards your answer. Okay. So what are the options? So either you can read the question first, then the options, then the paragraph. Or you can read the question, then the paragraph, then you can move to the options. Okay. Okay, Anu, yes, my sincere thanks to all the faculties of Nidhu's Academy. I cleared my OET examination with this, okay, marks. Okay, congratulations, Anu, and all the very best for your future. Okay, I'm so happy to hear about that. Okay, so coming back, so what are the options mentioned? So option A, do attaching quickly only if you are experienced. So my keywords from the question, guidelines, then undertaking, preparation. So these are my keywords from the question. And what about option A? Do attaching quickly only if you are experienced. So my keywords, attaching quickly and only. Then option B, avoid spilling the plaster during the process. So my keywords, avoid, then spilling, during. And from option C, soak plaster bandages and the bandage. Soak plaster and the bandage in a 40 degrees Celsius hot water. So my keywords, then plaster and bandage. Okay, then what about the paragraph? So plaster bandages, that is the title. Plaster bandages are impregnated with plaster. They provide reliable fixation of the broken bone. It is a hydrophilic bandage which is impregnated with fine plaster. The bandages are wrapped in moisture-proof packaging. Moisture would harden the plaster and the bandage would be spoiled. Before use, the bandage is soaked in a 40 degrees Celsius hot water. So from that line, we can eliminate which option? Before use. So question is asking you regarding preparation time during the process. Okay. But before use, you can soak the bandage, not the plaster, the bandage. So which means we can eliminate option C. It is contradictory. We are not soaking plaster and bandage. We are just soaking the bandage before use. And the bandage is not moved in this point so as not to spill the plaster. Then it is removed and gently wrung and then immediately attached. Attaching requires experiences. It must be done quickly. The time for molding the bandage is short, within 2 to 3 minutes. Okay, so what about option A? Do attaching quickly only if you are experienced. And as we know, we will attach the bandage only after the process. Okay, so first option A is all about after the process. So we can eliminate option A, as well as option C is all about before the procedure. Question is asking you regarding during the process, the preparation time. So which means option B is the correct answer. Avoid spilling the plaster during the process. Okay, so where is it mentioned? See, it is mentioned here. The bandage is not moved at this point so as not spill the plaster. So that is the correct answer. A lot of answers here. Yes. Okay, Anu. Jobin, yes. Priya, Raju, Benisha. Okay. Good afternoon, everyone. And your answer is option B, right, Benisha? Okay, Anu. Okay, Anu. Jobin, Reba, Megha, Reshma, Liji, Abhi. Okay. Anisha, yes, it is option B. Very good. So now we are moving to the next one. Okay, so before that, let me remind you something. Part B is all about paraphrasing. So what is paraphrasing? Let me know in the comments, what is paraphrasing? Do you have any idea? Paraphrasing. What is paraphrasing? I can say part B and part C is all about paraphrasing. But in part A, it is something different, which we can say it will be a play with synonyms. Okay, so what do you mean by synonyms? Synonym, which means the same meaning but different words. And what is paraphrasing? Okay, paraphrasing is not synonyms. Okay, yeah, there is a slight connection with synonyms, but it is entirely different. What is paraphrasing? If you know what is paraphrasing, then you can do part B and part C very easily. Similar meaning with synonyms. Okay, Mega, almost the same, but yeah, I know, finding out synonyms words. Okay, it's not about synonyms, okay? Because paraphrasing, which means it's all about the sentence, not about words. And that entire sentence will be different. Okay, the meaning from the paragraph will be the same into your answer option, but that answer option or the sentence will be entirely different. So that is called paraphrasing. Okay, rephrasing, restructuring. All right, so that's all about paraphrasing. So now we are moving to, yes, our usual part, that is part A, leishmaniasis. So the topic, we have another new topic, leishmaniasis. Okay, so what is all about part A? Yes, let's summarize everything. Part A is all about 15-minute session. Okay, out of the 60 minutes, you will get 15 minutes for the completion of part A. Okay, and what is important in part A? Why this part A is mentioned in the reading session? As you know, it's all about locating your answers. Okay, whether you are able to locate a particular procedure or locate a particular explanation or definition from the hard copy or yeah, whatever it is. So whether you are they were checking about whether you are able to locate those answers. So that's all about part A. And in part A, we have 4 different texts, entirely different texts. Text A, text B, text C, and text D. Okay, and one of the text will be a pictorial. As I was always saying, one of the text will be a pictorial, maybe a chart or a diagram or a table. Especially it will be a table. You have to give a little bit focus to each and every small tables. Okay, yeah, that's all about the time and the text. And what about the questions? Okay, we have 20 questions in total. And for this 20 questions can be categorized into 3 different types. Okay, so 1 to 7 set of questions that can be called match the following questions, and 8 to 14 set of questions that can be called short answer questions, and the rest of the questions which are called fill in the blanks. Okay, yes, so in 1 to 7 maybe you will get the texts, okay, repeatedly, maybe text A, text B, text C or text D, whatever it can repeat. And from 8 to 14 set of questions, that is short answer question, and the important instruction for short answer as well as fill in the blanks will be, you can write it in a word or a short phrase. Okay, so always remember about that, because if you're writing more than 3 or 4 words, then they will strike off your answers. Okay, so don't do careless mistake. Yeah, so it's coming back to part A, different text, okay, and all about the type of questions. Then what is another important thing in part A? What about the strategy? Any idea? What about the strategy? If you know the strategy, please comment and tell me what you know. What do you know about that particular strategy? Okay, yes. So what is your method? Which method you guys are doing for the completion of part A within 15 minutes? Actually, if you are practicing daily, okay, skimming and scanning, very good. Yes, okay, skimming and scanning. Yeah, so if you're practicing daily, definitely you can do part A within 8 minutes. Okay, so that's it. Okay, so what is skimming and scanning? Okay, Jinu, skimming and scanning. Okay, GN, yes, skimming and scanning. Reba, fast reading and searching words. Okay, so what do you mean by fast reading? I know that skimming, which means fast reading. So what do you mean by fast reading? Okay, so if you know the language, definitely with the help of the words and letters, you can read whatever you want, okay, without understanding a single word, the meaning. But see, don't search for the meanings from part A, because the reason is that we have only 15 minutes. So within this stipulated period of time, you don't have that much time to read everything and understand the meaning. So instead of that, you can fast read each of the texts. Okay, so when you do fast reading, speed reading, you can catch some or pick out some important words from each of the texts. So that is called searching. Okay, scanning. So skimming, which means fast reading, speed reading. Scanning, which means what? We are searching for some important words from each of the texts. Clear? Okay, quick reading. Yes, Juni, quick reading. Very good, Jansi. Yes, P2. Okay, yes. Okay, so happy to see you here. Yes. Okay, what about the keywords? What do you know about keywords? Okay, and as you know, when you read the question from part A as well as from B and C, we can mark some keywords from the question. So why we are marking keywords from the question? What is the relevance of marking keywords from the question? Any idea? Okay, you know that when you read something, yeah, especially the question, it's very important to mark keywords from the question. So what do you mean by keywords? Why we are marking keywords? Why keywords are so important? Okay, Mega gives an idea. Okay, gives an idea, which means an idea from the question, right? About the question. Okay, so when you mark keywords from the question, which means after marking the keywords, you will get an idea. Okay, I can say the summary of the question. Okay, so we are marking keywords just to understand the question. That's it. Okay, so maximum you can mark 3, not more than that. Okay, so when you mark keywords, it should be single words from the question, not combination of words or the entire sentence. Okay, single individual words from the question, meaning of the paragraph. Okay, when you mark keywords from the paragraph, it is just to understand the paragraph. So if it is from the question or if it is from the options, it is just to understand the question and option. Clear? Okay, so that's all about keywords. So yes, from the text, what are the keywords that you will mark? If you have a proper idea about something, definitely you can score in part A. So what are the keywords from part A? I can say you can mark all the titles. First of all, if they have mentioned, sometimes they will mention the title, sometimes they don't. So if they have mentioned the title, you can mark all the headings, title, then the subheadings. Okay, so what is next? The numbers. So whatever numbers mentioned, it's important to mark all the numbers. Signs and symbols. Okay, signs and symbols. Then what is next? Names. Maybe name of a person, name of a disease condition, name of an instrument, name of a country. Whatever names they have mentioned, you can mark all the names. What is the sixth one? Okay, a lot of comments. Okay, Juni, abbreviations, numbers, brackets, all headlines and time. So what do you mean time? What do you mean time? Okay, Mega, numbers, titles. Divya, okay, heading and subheading. Heading, subheading, Reba, okay. Okay, Reba, very good. Heading, subheading, numbers, words in bracket, italicized letters, plus bold, okay. Words indicate time, words indicate research, diagnosis, okay. So you should study that keywords in the proper order. It will be easy for you, okay. Okay, Mega, heading and subheading. Capital, number or name of a person. I don't understand. Okay, capital. What do you mean by that capital number? Okay. Brackets, italic, before, after. Okay, they were very good. Yes. Okay. So the time which indicates, the words that indicates time, which means before, after, previously, now, currently, presently. Yeah, a lot of words. Okay. So once again, first one is all about the headings. Then second one, subheadings. Okay, if you don't know, just mark it down. Headings, subheadings, numbers, signs and symbols, names. Then sixth one, abbreviation, which means short forms. Seventh one, those sentences or words which are in brackets. Eighth one, what is eighth one? Italicized or bold letters or words. Ninth one, the words that indicate time. Okay. 10th one, the words that indicate experiment. Then 11th one, the words that indicate research. 12th one, and I'm not saying you just mark everything, just give special emphasis to all the first and last line of each and every paragraph, as well as the 13th one is bullet points. Clear? So these are the 13 important keywords that you can mark. Okay, so that's that. So now we are moving to the question. Okay. So now tell me, what is your answer for the first question? The possible secondary infections that can be onset in patients with leishmaniasis. Okay. So my keywords from the question: possible, okay. Yeah. So my keywords from the question is possible, Then secondary infections. Okay, so what is your answer for the first question? Okay, so that is from text D. How it is text D? Yes, Reshma, Megha, Tessie, Juby, it is text D. Why? Why it is text D? As you can see here, text D is all about complications. Okay, so let's check about this particular text. Text A is all about this particular condition, leishmaniasis. So what is leishmaniasis, and what about the prevalence? Okay, the complications, the infections, complications, everything mentioned in text A. And what about text B? It's all about the diagnosis, I can say, test, different type of tests for the confirmation of this condition. And what about text C? It's all about the treatment, medications. Okay, there is a pictorial. And the text D is all about the complications of the medicine. Sorry, not the medicine, the particular disease condition. Okay, yeah. So it's all about, first question is all about complication. See the second point, secondary bacterial infection including pneumonia and tuberculosis. So that is from text D. So my answer is D. Second question, how does the drug named ketoconazole act in patients with leishmaniasis? So where is this particular name mentioned? The name of the medicine, drug. Okay, so the treatment or the medications which is mentioned in text C, clear. So that is from text C. Okay, a lot of medications mentioned in text C. Okay, Tessie, Anu, Reshma, Juby, Reba, Jansi. Yes, very good. Text C. Okay. Okay, Ashwati. Okay, Priya. Third one. So what is third question? Why is it difficult to estimate the total number of people with leishmaniasis? So difficult, estimates, total number of the condition. So prevalence. So where is it mentioned? As you can see here in text A, the last para, see, it can be hard to know how common leishmaniasis is. Experts estimate that there are 1.5 million to 2 million people worldwide who develop symptoms per year. So answer is from text A. Okay, so now we are moving to or jumping to the fourth question. Co-occurrence of which conditions can worsen the nature of leishmaniasis? Co-occurrence. So my keyword is co-occurrence, then worsen, then nature. Any idea? Fourth question. Okay, third question is option A. Sorry, text A. Okay, Lizzie. Okay, Megha, Priya. Okay, yeah. So what about fourth one? Okay, fourth one is all about co-occurrence of the condition which is mentioned in text D. Okay, so yes, it is in text D, fourth one. So co-infection, okay, with human immunodeficiency virus, and they have mentioned what are the other combinations, co-occurrence. Okay, so that is from text D. Then I am jumping to the fifth one, the most efficient way to diagnose visceral leishmaniasis. Most efficient visceral. So what is your answer? Fifth one. Yes, Noble, Anu, Reshma, Juby. Yes, it is text D for the fourth question. What about fifth one? Fifth question. Okay, Juby, it is text B. Okay, text B. Anu got the correct answer. Reba, yes, text B. So where is it mentioned in text B? Visceral leishmaniasis in text B. Okay, so from the first biopsy, that is needle biopsy, see the last line, a lab technician will use a microscope to look for leishmania. This is the best way to diagnose visceral leishmaniasis. So that is mentioned in text B. So our answer is B. Excellent. Okay, so sixth one, residing in which areas might increase the chance leishmaniasis. So my keywords, residing, areas, and chance. Okay, so answer is in text A, the first line itself. See, you get it from sand fly bites as well as, yeah, very good. So that is from yes, Jessie, Juby. Okay, so that is from text A. Okay, Noble, Priya, okay. So residing in which areas? So which areas? It is in the third para. Yeah, leishmaniasis often, most often affects people living in rural areas. So what is the question? In which area people residing? People residing in which area? So rural areas. That is from text A. Okay. Then seventh, the last one. The evaluation technique that might not be beneficial to confirm leishmaniasis. Okay, so evaluation, diagnosis, that is in text B. See the last point. Blood tests usually are not very useful for diagnosing current leishmania infection. So that is the answer, and which is from text B. Okay. So do you have any doubts regarding 1 to 7? Any of the questions? Okay, so majority of you got 7 out of 7, I guess, right? So please let me in the comments how many of you got correct answers for match the following questions. Okay. Okay, so yes. Okay, Megha. Okay, Megha, Anisha, Jubi, Tessie, Jansi, Anu, Priya, Abhi, okay. As usual, you got 7 out of 7. Okay, Reshma, okay, Ashwati. Okay, guys, yes, Binsi. Excellent, okay. Then, next set of question, that is short answer question. You can write it in a word or a short phrase, which means maximum 3 words. First question, where does, so we need where does the drug paromomycin acts upon, that in turn causes inhibition of protein synthesis. So my keywords are this. These are the keywords. Okay, Abhi. Okay, so what is your answer? Where does? So where does? Okay, so see this one. So where is it mentioned? So where does? Any idea? Okay, ribosomes. Okay. Where is it mentioned? It is mentioned in. Okay. So see the second, yes, ribosomes. Okay, Shruti, Binsi, Jansi, yes, Tessie. Answer is action on ribosomes causing inhibition of protein synthesis, and the medication is mentioned here on the left side. So answer should be ribosomes or ribosomes. Okay, so that is the answer. Okay, next one. 9th one, which procedure might be executed to assure cutaneous or mucosal leishmaniasis? Okay, so cutaneous, mucosal. Which procedure? So we need the answer to the question which procedure. So the name of the procedure. So which procedure? Any idea? Okay, so procedure which is mentioned in text B, as you know, different tests are mentioned here. So which procedure we are using? It's all about skin biopsy. So what is skin biopsy? A provider will take a sample of the tissue from an ulcer or on your skin, nose or mouth. A lab technician will test the sample for leishmania. This can diagnose cutaneous or mucosal leishmaniasis. So those are the keywords from the question. So our answer is the answer is skin biopsy. Okay, then 10th one. Co-infection with which virus? So we need the name of the virus. Which virus would make visceral leishmaniasis more complicated? So which virus can make this condition more worse? That is the question. So co-infection with what? Which virus? Okay, which virus? See the last one. Co-infection with human immunodeficiency virus. So if you want, you can write the abbreviation or you can write the full form. Both are correct. Okay, so either you can write HIV or you can write human immunodeficiency virus. So that is the answer. Okay, then 11th one. Okay, HIV. Yes, Jubi. Okay, Liji, Reba, Priya. Yes, HIV should be the answer. Okay. Then 11th one. The device. So we need the name of the device used by the lab technician to look for leishmaniasis following needle biopsy. Though these are my keywords, okay? Especially needle biopsy. So you can search for the keywords in the paragraph and you will find it in here. Text B, needle biopsy. So which device is using for that? It's not a needle, okay? Needle is not a device. So we can say the device is microscope. Yes. Okay, yes, it is from text B, microscope. Answer should be microscope or a microscope? Any idea? Whether it is microscope or a microscope. What is the question? The device is used by. So in the question itself they have mentioned the article the. So you don't have to repeat that article into your answer, which means you can just write microscope. That is your answer. Don't write a microscope. Answer should be microscope. Okay, because the is an article. So what are the articles? A and the. So the is already, article is already mentioned in the question. So you don't have to repeat the answer. So answer should be microscope. Clear? Clear, Reshma? Okay, Megha and Reshma, yes. It's not a microscope, guys. It is microscope. Okay. Then 12th one. Where do we find metastatic lesions along with tissue destruction in patients with leishmaniasis? So where do you find? Again, where? Okay, 12th one. So that answer should be nasopharynx, right? Yes, it is from text D. So where is it mentioned, nasopharynx? So metastatic lesions, so these are our keywords, is in the nasopharynx with tissue destruction. So answer should be nasopharynx. Okay. Then 13th one. The bite from which organism? So we need the name of the particular organism. Which organism will make you pray for leishmaniasis? So direct answer from text A, that organism should be sandfly bites. Okay, answer is not sandfly bites, answer is sandfly. Okay, so that is from text A, answer should be sandfly. Okay, yes, Jubi, Anu, Tessie, Princey, Bincy, okay, Ashwati, Reshma, Megha, Jansi, Anu, okay, it is sandfly, very good. Then 14th one, which drug triggers, okay, Reba, Megha, sandfly, very good guys, correct answer. Okay, then which drug triggers programmed cell death? So we need name of the medicine. Which drug? So which drug? Name of the medicine. Any idea? Which drug we are using? What is your answer? So drugs which is mentioned in text C. So that should be, yes, miltefosine. Okay, miltefosine should be the answer. Trigger programmed cell death. So answer should be miltefosine from text C. So that is the name of the medicine. Yes, it is from, it's not from part C, text C. Okay, yes, miltefosine. Yes, yes, Tenson. Okay. So that is the end of short answer question. So now we are jumping to 15 to 20, fill in the blanks. Okay, again the same instructions, word, short phrase. Okay, I'm repeating everything because I know that you guys will make careless mistakes, right? So please remember, you can write it in a word or a short phrase, which means 3 words maximum, not more than that. So the first question, complications of leishmaniasis occur as a consequence of anemia and leukopenia and something else. So what is the missing word here? Complications of leishmaniasis occur as a consequence of anemia, leukopenia and something. So what is that something? Okay, it is thrombocytopenia. Yes. Okay, Tessie. Okay guys, so where did you get that answer from? Which text? Thrombocytopenia. Answer should be from text D, right? So where is it mentioned in text D? So this is the missing word, right? So these are the keywords, anemia and leukopenia. The missing word is thrombocytopenia. That should be the answer from text D. Okay. Then 16th question. In skin biopsy, a provider will take a sample of tissue from dash. From what? From where? Not from what, from where? Okay. So yes. So what is the missing word? From an dash on your skin. Ulcer on your skin. Yes. Which is from text B. Skin biopsy is taking sample from an ulcer on your skin. So answer should be ulcer. Okay. 17th. Leishmaniasis most often affects people living in rural areas of tropical regions or areas with inadequate dash. So what is the missing word? Okay, Priya, yes, correct. It is from text D. Yes, guys. Yes. Okay, Jubi, ulcer, okay. Answer should be sanitation. Yes, Tessie, Bimsi, yes, very good. Sanitation should be the answer. That is from text A. Where is it mentioned? The third para, right? Leishmaniasis most often affects people living in rural areas of tropical regions. So those are the keywords from the question. Of areas with inadequate sanitation. So answer should be sanitation from text A. Right? Okay. Then the next one, 18th one. Dash is a prototype. So that itself is starting with the fill in the blank. Okay. So which means the capital letter, the first letter should be capitals. So dash is a prototype of pyrimidine that can inhibit the growth. Okay. So name of a medicine mentioned. So what is it? Dash is a prototype. So what is a prototype? Allopurinol is the answer. And which is from text C, yes, the medications, the last one. So that prototype which is connected with allopurinol. So answer should be allopurinol from text D. C. 19th one. Late stages of leishmaniasis includes edema, cachexia and something else. So what is that? Okay. So answer is from text D. So what is it? Any idea? Hyperpigmentation from, okay, so the last stages, what are the last stages? Edema, cachexia and hyperpigmentation. So answer should be hyperpigmentation. Yes. So the final question. Leishmania parasites are dash. Okay, one-celled organisms that are too small to see without a microscope. So without a microscope, we can't able to see this parasites. So which parasites? Okay, so that is protozoa, which is from text A. See, Leishmania parasites are protozoa. So that is protozoa. Okay, so yes. So a lot of answers, and I'm so happy that you guys are participating so well. So definitely you guys are gonna pass this exam, clear this exam for sure. Trust me. Okay, so that's all about today. And we will meet you tomorrow with the same time, another new topic. So thank you all. God bless you.